first quarterly report of the National Disability Insurance Scheme shows it's off to a slow start, with thousands fewer people enrolled than it had hoped. Norman Hamont reports.
You don't have to tell this family about teething problems with the NDIS. Both Jasmine Fish and her brother, Brendan, live with cerebral palsy and have been in the scheme for 3 years. But this month, Tasmania ended state taxi subsidies for NDIS participants.
Their fares are going to go up considerably.
That means taxi costs of $18,000 a year, 3 times what Jasmine gets under the NDIS.
This is going to be a wrecking ball for their programs because they simply won't be able to access them.
Transport is just one problem for the NDIS. Figures from July through September show it's also struggling to meet its enrollment targets. The NDIS originally estimated 20,264 new participants would be enrolled in the first quarter. It was later forced to cut that estimate in half, in part due to persistent IT problems. It failed to meet even the revised estimate, with 7,440 new participants enrolled. The Minister of Social Services says there have been problems, but they are being sorted.
This is effectively the first couple of kilometres of a marathon, basically, so it's very, very early days.
Jacinta Kelly, who lives with cerebral palsy, represents the huge challenges. Trips to programs and to see friends are rare, with transport under her NDIS plan limited. Her father says depression has set in.
I don't think she would have had that happen had she been interacting with other people like she was.
The needs of participants like Jacinta and the need to control costs. Not an easy balance for the NDIS. Norman Hermont, ABC News.